If an auditor compares your documentation to the decision you made and those two things do not match, that inconsistency can trigger a deeper review, even when your decisions were correct. Most professionals think documentation risk comes from missing details. In reality, audit attention often begins when documentation and decisions stop aligning. The note describes one level of concern, the action reflects another. And when those two signals do not match, the system starts asking questions. So today, I want to show you how to align your documentation with your decisions before auditors do it for you. When auditors review documentation, they are not just reading individual notes. They are comparing signals. They look at what was written. They look at what action followed, and they ask a simple question. Do these two things match? If your documentation describes a mild situation, yet your action escalates aggressively, that creates a mismatch. If your documentation describes significant concern, yet the plan appears minimal, that creates a different kind of mismatch. In both situations, the issue is not necessarily the decision. The issue is the alignment. Audits frequently begin when documentation and decisions stop telling the same story. Let's look at the first common situation. A clinician makes a cautious or protective decision. Maybe additional testing is ordered. Maybe monitoring is escalated, or a follow-up interval is shortened. Those actions may be completely appropriate. However, if the documentation describing the findings sounds mild or routine, audits notice the gap. The note suggests low concern. The action, however, suggests elevated concern. When those two signals diverge, reviewers begin looking more closely. Not because the decision was wrong, because the documentation does not explain the decision. Now, let's look at the opposite situation. Sometimes documentation language becomes very serious. Strong wording appears in the note. Risk is emphasized. Concern is highlighted. Yet the plan that follows is relatively minimal. There's no escalation, no change in management, no follow-up adjustments. In that case, the documentation suggests high concern, yet the action suggests stability. Again, auditors see the mismatch. So, what does alignment actually mean? Alignment means that three elements move together: findings, interpretation, and plan. When findings appear in documentation, the interpretation should logically follow, and the plan should reflect that interpretation. For example, if documentation identifies a meaningful change in condition, the plan should acknowledge that change. If the plan includes escalation, the documentation should clearly explain why that escalation occurred. It requires clear connections. Auditors are not expecting perfection. They are, however, expecting coherence. Let's look at a practical example. Imagine a note that states, patient stable, no new concerns identified. But the plan immediately orders additional testing and closer monitoring. Those two statements create tension. A reviewer may ask, what promoted the escalation? Where in the documentation is that concern reflected? The issue is not the testing itself. The issue is that the documentation did not prepare the reader for the decision. Now, compare that to a slightly different structure. Findings are documented. The interpretation acknowledges a possible concern. Then the plan follows logically from that interpretation. The escalation now makes sense. Nothing dramatic changed. The documentation simply aligned with the decision. This alignment matters because audits review patterns across time. If decisions repeatedly appear stronger than the documentation describing them, reviewers begin to question documentation reliability. If documentation repeatedly signals concern without corresponding actions, reviewers question decision consistency. In both cases, the system is evaluating the relationship between what was written and what was done. So, How do we reduce this risk? Well, there are 3 simple habits that help stabilize documentation alignment. First, connect your findings to your interpretation. If something changed, state that clearly. If something remains stable, state that clearly too. Avoid leaving the reader to infer the meaning. Second, connect your interpretation to your plan. The reader should understand why the plan makes sense, not through long explanations, but through logical structure. Third, review your note briefly before closing it. Ask one question. Does the documentation explain the decision that follows? If the answer is yes, alignment is intact. If the answer is unclear, a small adjustment can prevent confusion later. Remember, auditors do not evaluate language. They evaluate relationships. The relationship between findings and interpretation. The relationship between interpretation and action. When those relationships are clear, documentation appears stable and defensible. When those relationships drift apart, reviewers begin looking deeper. So, the goal is not longer documentation. The goal is aligned documentation. When findings, interpretation, and decisions move together, your documentation tells a coherent story. And coherent documentation attracts far less audit attention. If this topic is relevant to your work, the next episode explains how inconsistent documentation patterns trigger deeper audit reviews over time. Because once documentation patterns become visible, the system begins reading your notes very differently.